Welcome back. Let's take you through the top story at this hour. Now, no need to test if you are asymptomatic. No need to test if you're traveling domestic. No need to test unless you're coming from an at-risk nation. In fact, you don't need to test even if you come in contact with a positive patient. Basically, test only if you are at risk. That is, if you're older, if you have comorbidities. These are the new testing guidelines that have come out from ICMR as India battles the third wave of COVID-19. The same guidelines also talk about lower hospitalization rates compared to, say, the second wave. Hospitalization rate of 5 to 10% in the third wave, while the second wave, the official data talks about hospitalization in the range of 20 to 23%. Now, how exactly are we to see these guidelines? We'll take it forward with our guest now. Joining us now is Dr. Neetu Jain, Senior Pulmonologist at PSRI Hospital. Thank you so much for your time this morning, ma'am. We also have with us Dr. Farah Ingle, Director of Internal Medicine at Fortis Hiranandani Hospital in Vashi. Good morning. And we also have with us Dr. Vishal Rao. He's the Dean, Center for Academic Research, SCG Cancer Center. He's also part of the COVID task force and a member of the expert committee there. Dr. Rao, if I can begin with you. Basically, the government is telling us that till the time you are at risk, just to lay it out for our viewers again, because they really need to understand this. If you're older, if you are above 60, that is, if you have comorbidities, that would include being obese, it would include hypertension, it would include diabetes. And also, if you are undergoing a major treatment, it could be for cancer, it could be for any other life-threatening disease as well, you are at risk. So you get tested proactively, but the rest of the so-called younger population, somebody with better immunity, is not required to test at all. Your thoughts on that?
Thank you, Sonal. I think the current step of ICMR releasing these guidelines is towards the evolution of understanding of COVID and conquering most aspects of what we have done in this race between the vaccine and the variants. With Omicron, it's been a step towards understanding better that we are moving towards flu and an endemicity with COVID, and to reduce the burden of the cost and panic to people with multiple inconveniences of testing related issues. Because now that we know that it's very hard to discriminate flu versus that of COVID, and the symptoms not being that like the Delta wave of breathlessness, hospitalization, where there was an alarming need to be cautious, to be taking very, very serious steps in order to prevent. I think this step kind of gives a very important signal to the citizens to reassure them that don't panic. It's in a step to say that you need to be cautious while you're doing social and entertainment activities, but it also kind of supports the economic activities not to curb it, and to ensure that there is a move towards strengthening the people's assurances to say that I think the phase of panic is over and we are moving towards conquering the pandemic in a much stronger way. I think these are the messages we get.
Right, but there are several who would say this is just number management right now. I understand. And if Dr. Farah can actually weigh in on this, I understand that UK, United States have also taken similar measures, but that's because they have sort of constraints when it comes to testing kits. It was also a measure that was taken by the UK government earlier because there weren't any medical officers and healthcare workers actually left in hospitals because all of them were testing positive as well. This was to bring them back early, ensure that the system keeps running as well. Is India at that stage that we need to enforce it?
Yeah, good morning and thank you, Sonal, for having me here. As rightly said by Dr. Rao, number of cases are on the rise. We are in the third wave, but what has been seen here with Omicron is that the cases coming these days are mild, asymptomatic or mild. We are not getting many serious patients, and the livelihood was at stake when you saw that with the Delta wave, the second wave which we had. So this time, because most of the patients are either asymptomatic or having mild infections, and because the livelihood should not get affected, the economy of the country should not get impacted, ICMR has come up with the fresh guidelines, which is the advisory on the purposive testing strategy for COVID-19 cases in India. And that is to help us to detect the patients early, whoever are symptomatic, so that they can be quickly isolated and taken care of. And yes, ICMR has also stressed on the care of elderly people who are more than 60 years of age, or those people who have comorbidities, meaning they are diabetic, hypertensive, have kidney issues, malignancy, or obesity. So the
Dr.
specifications
Farah, I'm just intruding here to say that does this mean that younger people in the country are not at risk at all?
No, it's not like that, but younger people usually do not suffer from lethal infections. That is what is seen in this wave of Omicron. So younger people, it is not like because they have not been made compulsion to test, is not that they should not care for themselves or they should not watch for themselves. If they are asymptomatic, they are still required to take all the precautions. They have supposed to follow the COVID appropriate behavior. Proper masking, social distance and sanitization still needs to be followed by one and all. But then if they develop symptoms, then they should go for testing. Otherwise, for 10 days, they have to keep a watch on themselves and follow COVID appropriate behavior. And if they develop symptoms, definitely they have to go for the testing.
They have to go for the testing is what you're saying. This is unlike what ICMR is saying. They're saying that you don't need to undergo a test in case you are asymptomatic. So that leaves us assuming that every second person around you is going to be asymptomatic. So you got to get your guard up. Essentially, that's what I'm picking up from you. Dr. Neetu Jain, then come in on this. We have ICMR telling us this. We have doctors who are in administrative positions quite happy with the fact that this is happening because they actually have workforce now. Otherwise, everybody, cluster, nurses, doctors, even DCPs and police forces are seeing people test positive and then out of the workforce altogether. But then there are comments coming from WHO, which continues to say it is not like flu. There are comments coming from, say, Mumbai doctors, who are now saying that we have seen hospitalization go up only in the second week after the cases have peaked. So they're saying we haven't seen the extent of hospitalization, the full extent of it just yet, because now the hospitalizations will really pick up. So the question then is, who do you believe? Do you believe WHO telling you one thing, or do you go by your local doctors? Do you go by what the ICMR and the government is saying?
The ICMR and government is saying that you don't test the asymptomatic individual, but it is not saying that you do not follow the COVID appropriate behavior. If you feel that you are probably exposed and likely to be infected, you are supposed to watch for your symptoms and not completely isolate yourself, but be careful on that account. As far as symptoms and severity of disease is concerned, till now we have also seen only mild disease and hardly any hospitalization. But as WHO said, we cannot let our guard down and think that this is going to be the story all over. And people, even if the number is 5 to 10% of the hospitalization, absolute numbers can be very large, especially with people with comorbidities and older people. So we just cannot let our guard down there. We should be testing people who have comorbidities and have symptoms.
All right. So I'm just trying to understand what the messaging here is by ICMR. And Dr. Vishal Rao, help me understand that. Then this basically means that the government is saying, till the time you don't have symptoms, don't test. They're saying you don't need to go and overwhelm the system also. Is this in preparation of what could happen? Is that what the thinking might have been?
So to put this into a perspective, we are at a very interesting evolutionary stage where there are two aspects. I think I agree with the argument that you're saying, because WHO has time and again come out and said that this has a potential to overwhelm the system. Now, why does it say so? Let me explain. If you look at the data that came out from South Africa, from November 2nd week onwards, when they detected Omicron, till the end of December, there was a rapid rise and a rapid fall, with the peak at December 12th with 40,000 new cases per day. But it was a rapid rise, rapid fall. And South African government came up with the data and said 20% admission rates kind of data for Delta, compared to that 4% for Omicron.
Right.
Which is comparative to India, what we experienced in the Delta phase. Now, in them, what they face, if you look at South Africa population, it is as good as that of Karnataka. And South Africa's vaccination rate is half as that of India. So here there are two aspects. Omicron does not spread in the lung. It spreads more in the bronchus. It multiplies faster in the bronchus and does not overwhelm the lungs. And the second is that our vaccination rate has been very good. So both of these put together actually give us the assurance to say that Omicron is not going to overwhelm the healthcare system based on the current data. However, the speed at which Omicron spreads is double faster than that of Delta with 1.5 days doubling time. So even that 4% we are taking into account, that 4% can flood the system very quickly, like what the panelist pointed out, that it can flood the hospitals.
Hold that thought, because the same data actually shows that for every 100 cases of Delta hospitalization, there could be 125 to 250 hospitalizations in the present Omicron surge. So it's not adding up.
It does add up, because the speed at which Delta moves and the speed at which Omicron moves, if you see, Delta may take 7 days, Omicron is taking 1.5 to 3 days. So it's double faster. So the potential and the speed at which it is going to overwhelm the system, there is no doubt about it, and nobody is arguing it. And I think the ICMR is also concording with that to say that these people who are going to be requiring hospitalization, do not ignore them. The symptomatic, I don't think there is any argument to say that if you are symptomatic, I mean, I'm talking in my own neighborhood with my friends who are calling, I'm saying if you have symptoms, sore throat, pain, anything, quickly get yourself tested. But do not hit the panic button if you have no symptoms, because there is a lot of paranoia going on. There is going to be a lot of unnecessary bed booking that's going to go on, which is going to overwhelm the healthcare system unnecessarily. And that's already started here, where we are seeing it. We need not panic like we did before in Delta, because this is a different strain, doesn't trouble the lungs, and we are vaccinated. So I think the message that needs to go to people is don't create panic button situations. Don't go reserving beds because you have a positive thing. Look at this virus. It's not going to trouble you. But if you have symptoms, you have comorbidities, you have trouble, yes, you have to be guarded. You need to take opinion. And there is no doubt that this can overwhelm the healthcare system for the symptomatic who can worsen. And who are they? They are the comorbid. They are the people who are elderly age group. They are the unvaccinated. And this group is what time and again they've shown is the most important one. I would like to close with one more point.
And this is the group, Doctor, I'll let you finish in a moment, but this is the group that you're seeing more and more on oxygen support in hospitals, in your ICUs and ventilators as well, the same group?
As of now, if you look at Karnataka data, it has not overwhelmed the system as of now at all. And we believe that in the coming weeks, we need to closely watch this as it reaches the tipping point numbers. But till that time, we have South Africa data to reassure us, saying that there is no panic.
Okay.
I believe that the answer for this is going to be 18 to 60 being opened for vaccination, because they need a booster.
Right.
Finally, we have to have the vaccination win this race. Today, Israel is moved to the 4th dose. I think somewhere there are 29 companies across the world that have achieved, that have got emergency authorizations. I think it's time for India to open up and see if we can get all our youngsters the booster dose.
Are we not too late on that already? We're already in middle of third wave, and then we're talking about boosters over here. Well, that's a thought we leave you with, but that's all the time we have. Thank you all so much for joining us on that discussion on the new guidelines that have come from ICMR. If you are symptomatic, however, regardless of your age, your health condition, you must get tested. It is only applying to those who are asymptomatic.